I took the NCLEX practice exam so you don't have to. Question 1. In children suspected to have a diagnosis of diabetes, which one of the following complaints would be most likely to prompt parents to take their school-aged child for evaluation? Option A, polyphagia. Option B, dehydration. Option C, bedwetting. Option D, a weight loss. The correct answer is option C, bedwetting. Bedwetting, enuresis, in a previously toilet-trained child is a classic sign of polyuria associated with new-onset diabetes mellitus. Question 2. A 3-year-old child comes to the pediatric clinic after the sudden onset of findings that include irritability, thick muffled voice, croaking on inspiration, hot to touch, sitting leaning forward, tongue protruding, drooling, and suprasternal retractions. What should the nurse do first? Option A. Prepare the child for an X-ray of upper airways. Option B. Examine the child's throat. Option C. Collect a sputum specimen. Option D. Notify the healthcare provider of the child's status. The correct answer is option D. Notify the healthcare provider of the child's status. These are classic signs of epiglottitis. Examining the throat can cause severe airway spasm and occlusion. The provider must be notified immediately. Question 3. A client has been newly diagnosed with hypothyroidism and will take levothyroxine 50 micrograms per day by mouth. As part of the teaching plan, the nurse emphasizes that this medication, option A, should be taken in the morning. Option B, may decrease the client's energy level. Option C, must be stored in a dark container. Option D, will decrease the client's heart rate. The correct answer is option A, should be taken in the morning. Levothyroxine increases metabolic rate and energy levels, so it should be taken in the morning on an empty stomach to prevent insomnia. Question 4. The hospital has sounded the call for a disaster drill on the evening shift. Which of these clients would the nurse put first on the list to be discharged in order to make a room available for a new admission? Option A. A middle-aged client with a history of being ventilator dependent for over 7 years. Option B. A young adult with diabetes mellitus type 2 for over 10 years and admitted with antibiotic-induced diarrhea 24 hours ago. Option C. An elderly client with a history of hypertension, hypocholesterolemia, and lupus, admitted with Stevens-Johnson syndrome. Option D. An adolescent with a positive human immunodeficiency virus test admitted for acute cellulitis 48 hours ago. The correct answer is option A. A middle-aged client with a history of being ventilator dependent for over 7 years. A chronically ventilator-dependent patient who is stable represents baseline health for that individual and is often the safest to transfer or discharge to home care. Question 5. At a community health fair, the blood pressure of a 62-year-old client is 160/96 millimeters of mercury. The client states that their blood pressure is usually much lower. The nurse should tell the client to: Option A. Go get a blood pressure check within the next 48 to 72 hours. Option B. Check blood pressure again within 2 months. Option C. See the healthcare provider immediately. Option D. Visit the healthcare provider within 1 week for a blood pressure check. The correct answer is option A. Go get a blood pressure check within the next 48 to 72 hours. An isolated elevated reading requires follow-up in the near term, 48 to 72 hours, to determine if it is a sustained hypertensive issue. Question 6. What would the nurse expect to see while assessing the growth of children during their school-age years? Option A. Decreasing amounts of body fat and muscle mass. Option B. Little change in body appearance from year to year. Option C. Progressive height increase of 4 inches each year. Option D. Yearly weight gain of about 5.5 pounds per year. The correct answer is option D. Yearly weight gain of about 5.5 pounds per year. School-age children typically have a steady, predictable growth rate, gaining approximately 5 to 7 pounds per year. Question 7. A client is admitted to the emergency room with renal calculi and is complaining of moderate to severe flank pain and nausea. The client's temperature is 100.8 degrees Fahrenheit. The priority nursing goal for this client is: Option A, maintain fluid and electrolyte balance. Option B, control nausea. Option C, manage pain. Option D, prevent urinary tract infection. The correct answer is option C, manage pain. Renal calculi cause excruciating pain. Managing the client's pain is the highest priority intervention. Question 8. Which complication of cardiac catheterization should the nurse monitor for in the initial 24 hours after the procedure? Option A, angina at rest. Option B, a thrombus formation. Option C, dizziness. Option D, a falling blood pressure. The correct answer is option B, thrombus formation. Thrombus formation at the insertion site is a major risk following cardiac catheterization due to vessel trauma. Question 9. A child who ingested 15 maximum strength acetaminophen tablets 45 minutes ago is seen in the emergency department. Which of these orders should the nurse do first? Option A, gastric lavage is needed. Option B, the acetylcysteine for age per pharmacy. Option C, start an intravenous dextrose 5% with 0.33% normal saline. Option D, activated charcoal per pharmacy. The correct answer is option A, gastric lavage is needed. If within 1 hour of a lethal ingestion, gastric lavage may be considered first to physically remove the unabsorbed pills from the stomach. Question 10. Which individual is at greatest risk for developing hypertension? Option A, 45-year-old African American attorney. Option B, 60-year-old Asian American shop owner. Option C, 40-year-old Caucasian nurse. Option D, 55-year-old Hispanic teacher. The correct answer is option A, 45-year-old African American attorney. African Americans have the highest prevalence of hypertension among ethnic groups, making this individual the highest risk. Question 11. The nurse is giving discharge teaching to a client 7 days post myocardial infarction. He asks the nurse why he must wait 6 weeks before having sexual intercourse. What is the best response by the nurse to this question? Option A. You need to regain your strength before attempting such exertion. Option B. When you can climb 2 flights of stairs without problems, it is generally safe. Option C. Have a glass of wine to relax you, then you can try to have sex. Option D. If you can maintain an active walking program, you will have less risk. The correct answer is option B. When you can climb 2 flights of stairs without problems, it is generally safe. Climbing 2 flights of stairs without shortness of breath or chest pain is a standard metric used to determine if a patient's heart can handle the exertion of sexual activity. Question 12. Which of the following should the nurse implement to prepare a client for a kidney, ureter, bladder radiograph test? Option A. Client must be nothing by mouth before the examination. Option B. Enema to be administered prior to the examination. Option C. Medicate the client with Lasix 20 mg intravenous 30 minutes prior. Option D. No special orders are necessary for this examination. The correct answer is option D. No special orders are necessary for this examination. A standard cub radiograph is a simple X-ray of the abdomen and does not require fasting, bowel prep, or medication. Question 13. The home health nurse visits a male client to provide wound care and finds the client lethargic and confused. His wife states he fell down the stairs 2 hours ago. The nurse should: Option A. Place a call to the client's healthcare provider for instructions. Option B. Send him to the emergency room for evaluation. Option C. Reassure the client's wife that the symptoms are transient. Option D. Instruct the client's wife to call the doctor if his symptoms become worse. The correct answer is option B. Send him to the emergency room for evaluation. Lethargy and confusion following a head trauma are classic signs of increased intracranial pressure and require immediate emergency evaluation. Question 14. A child who has recently been diagnosed with cystic fibrosis is in a pediatric clinic where a nurse is performing an assessment. Which later finding of this disease would the nurse not expect to see at this time? Option A, positive sweat test. Option B, bulky, greasy stools. Option C, moist, productive cough. Option D, meconium ileus. The correct answer is option C, moist, productive cough. A moist, productive cough is an early finding in cystic fibrosis. In later stages, the cough typically becomes dry, hacking, and non-productive due to extremely thick mucus. Question 15. The nurse is performing a neurological assessment on a client post-right cerebrovascular accident. Which finding, if observed by the nurse, would warrant immediate attention? Option A, decrease in level of consciousness. Option B, loss of bladder control. Option C, altered sensation to stimuli. Option D, emotional lability. The correct answer is option A, decrease in level of consciousness. A decrease in the level of consciousness is often the first sign of increasing intracranial pressure or extending brain injury.